Welcome to Nothing to Hide, Hidden Health Stories. Now in this episode I'm sitting down with an incredible young woman who's been through years of pain, misdiagnosis and surgery, but yet continues to move, dance and inspire others with her strength. She's just recently been named the face of Endometriosis UK charity fundraiser, and this one's for people who have ever felt dismissed or misunderstood, because what she's built through all of this is nothing short of inspiring. And this is Kate. Right. Okay, Kate. Welcome.
Thanks.
How are you?
I'm good.
Good.
Thank you.
Good. So, Kate, I want to go into your condition, but I also want to see who you are first.
Okay.
So, for anybody who hasn't met you, tell us a little bit about outside of your health condition and outside of your health journey.
Okay. Cool. So, God, how do I even describe myself?
It's a
I don't
tough
know.
one to start.
It is a tough
We're
one.
going straight in.
So very much into the gym. So I was actually grew up as a dancer. So did that at university. Did it pretty much from the age of 2. Wanted to go on and do that as a profession, but I was actually diagnosed with a different autoimmune disease. So that meant I just wasn't able to keep up with that. So got into the gym. Recently gone travelling to Australia as well. Did that for like 7 to 8 months. Love spontaneity, love reading, love going on hikes and doing all those
Lovely.
things. So yeah.
Yeah. So I'm now going to go deeper.
Okay.
And we're going to talk about your condition.
Yeah.
And or conditions, I should say. So firstly, what is your conditions?
So my autoimmune disease, that is something called intermediate uveitis. So that is basically when my white blood cell count has been too high. So my white blood cell count has actually started to attack the inside of my body. So I'll restart that. So if anyone who gets sick, typically your white blood cell count would increase to fight off the infection. My body is like that even when I'm not ill. So it's got nothing to attack. So it therefore attacks my body and over time has caused the back of my retina to basically like disintegrate in my eye. It sounds way more serious than it actually is. Like I have been in and out of hospital probably like as an early teenager with it, and it has affected my eyesight. I used to be on like quite a high dose of oral steroids, so that was a problem in itself. Really difficult, especially when you're around that age, because typically when you're on quite a high dose, you end up with what people like to call moon face. So your face puffs up, you gain weight. Wasn't a very nice time, but it's never really had a huge impact on my eyesight itself. I'd probably say more so the rest of my body and mentally dealing with that. And then the other part is endometriosis.
Okay. Tell me more about that one.
So endometriosis is basically where tissue similar to your endometrial lining starts growing in different places outside of the uterus. So typically it'll attach to different body parts. A lot of that does tend to come out in like on the bladder or on the bowel, mainly in the pelvic region, but it has come out in other people's cases where it's been shown to come up on the shoulder or well in the chest area or even in the brain. It works very similar to the endometrial lining, so it'll thicken around certain parts of the cycle and would bleed. However, unlike a normal period where it should be, you don't bleed out, so your body starts bleeding internally. What that then means is that you are then left with a lot of scarring. That blood has nowhere to go. Inflammation, scarring, obviously an awful lot of pain that comes with that. And unfortunately, in my case, it's gone to a point now where some of my organs are actually glued and stuck together.
So going from that now then, so where you are currently now, when did go all the way back to the start? Let's rewind all the way back to perhaps when you were first realising there was something not right. How did you go about that? What kind of signs were you looking for? What kind of signs were not right in your case?
It was quite hard to navigate at the time because a lot of the things with endometriosis, it kind of appears when your cycle starts appearing. So usually most girls around like 12 to 13. I did, now looking back, because I didn't know at the time, but looking back, I did start my cycle quite a lot later compared to my friends. But when I did actually get my cycle, I was in so much pain. And I remember actually being in school and going home and like crying. I was like, how do people and like how are all my friends and stuff walking around like navigating just going through life as normal? Because I'm like, I feel like I need to be in bed for about 5 days. Like I'm in so much pain. And I went to the doctor. I don't know how long in between that I went to the doctor, but I went to the doctor and said like I'm in pain with my period. And my family do actually have a family history of endometriosis anyway, which is quite common as well. And I believe my mum did say like we do have a family history of endometriosis, and the typical way of like a lot of GPs will handle that is they'll prescribe you some kind of contraceptive. So in my case, I was put on the pill, and I was basically told that'll help your symptoms. Like off you go. So it wasn't that easy because with the pill you have two different types. You can have one where you take a break in between and you'd have not a period, but you'd have like a withdrawal bleed. That you shouldn't experience any pain with, but I still did, like a normal period. So again, went back to the doctor a few years later and just said like this still isn't right. And they were just like, well, we'll just give you another pill, don't have a period or withdrawal bleed at all. So at the time, again, because I didn't know the research and didn't know the history about it now, I was like, great, like no period, no pain, like happy days. And then things started kind of appearing with my bowel. So I then went back to the doctors again. So I don't know if I've got like IBS or just something isn't right. Like I'm experiencing a lot of like urgency, and sometimes like a little bit of pain. At the time, it was quite mild, and they just said, it's probably just a bit of IBS. Like avoid certain foods like you would do, and keep a food diary and just see what could be triggering it. So that's what I did. And then about probably 2 years after that, it just progressively just got so much worse. And it's hard because you don't really know how to, I definitely didn't know how to like advocate for myself at that time to go like, no, like there's something a bit more going on here, like I need this looking into. And then I actually went to a gynecologist and said like, look, this is my food diary, these are when I've had my symptoms, this is when I was still on the pill, these are the dates when I'm having like the not incontinence at the time, but a lot of urgency and a lot of pain. And it was always kind of like around the end of the month. It was never in between. It was never at the beginning. It was always around the end of every month. So that in itself is a bit concerning. And my gynecologist said to me, she was like, yeah, I think we like maybe need to have a chat about anxiety. We like you can't have a cycle when you're on the pill. From what I know, that isn't actually true. You can still have a cycle when you're on the pill. And I think the fact that you've even come in here with a diary, XYZ, like we need to consider anxiety and we need to maybe consider some of this might just be in your head.
Wow.
But we'll send you for an MRI scan, we'll send you for like an ultrasound. But for me personally, I'd experienced a lot of that already. It got to a point, and I'd already had, I think, 3, maybe 4 ultrasounds in the time that had all come back normal. So I was just feeling obviously misunderstood, misheard, gaslit, and just thought, what's the point in having another scan that's come back normal all these other times? Like nothing's going to be any different. If anything, it's probably going to give my gynecologist more ammunition to say, look, there's nothing wrong with you. So I actually did say, like, do you not think this could be endometriosis? And I believe her words were something along the lines of, well, even if it is endometriosis, I don't think you really want to go down that route, because to get a diagnosis, you would have to have surgery, and you just don't want to go down that route. It's not very pleasant.
Wow.
That was
so what age was this? So what age was all this happening when you first started raising those concerns to...
I think I was probably around the age of like 15, 16 when I first raised the concerns, and then I only got my diagnosis just over a month and a half ago now.
And how have you feel as though you've coped, not just physically but mentally, in that gap now?
Yeah, because it's hard. like you have the physical aspects of endometriosis, and everyone's so different because it can affect you in so many different ways. Like I do have other people and friends that will experience like a lot of heavy bleeding and completely different symptoms to me, whereas I have complete opposite to that. I don't really experience a lot of bleeding, but I do experience a lot of bowel pain. So that in itself can be quite hard because you think sometimes people compare those symptoms even though you've got the same condition. I've had friends in the past that maybe not friends with anymore that maybe didn't understand my condition, so they like we could be out and about and I'd say like I really need to go to the toilet like now. They're like, oh, it's fine, like, there's a toilet like 20 minutes away. No, I can't wait 20 minutes, like I need to go now. And over the years, like I said, it has turned into, not very often, but a few times experiencing incontinence. So that for me has then left me in situations where I've felt very anxious to leave the house. Just like mentally, because I get quite a lot of like spasms as well, where I feel like I need to go but I can't.
Yeah.
Which again is really painful. But I think it's so relentless. To the point where it's just like you get to a point where I'll just be sitting in bed crying and just be like, I just want this to stop, and I just know that it won't. Even with like a lot of painkillers, and like I mean now, if I have like a flare up, I'll take like paracetamol, codeine, tramadol sometimes, muscle relaxant. I don't even know what else I can take at that point, but even that is like anything and everything, which in itself, like if you're having a period and your paracetamol and ibuprofen isn't doing it, like there's a clinical sign there in itself, and it's wrong.
I suppose that leads us on to the next question in terms of how does that make you feel from all of that you've just said and the experience you've had. How does that make you feel from that first conversation with medical advice and maybe saying it's just a period pain?
Yeah.
So how does that make you feel now to know obviously all of what you went through was more than just a period pain, but to be told that initially, and probably things could have been maybe put to a stop earlier, but how does that make you feel?
Yeah, it's hard, and it does still leave me with a lot of frustration and a lot of anger. I try to channel that anger and frustration into different places, which is why I want to go on and do what I want to do with my career and stuff now. But it's taken so much away from me, and I think looking back on like different experiences, it has made me question like my own kind of sanity in a way, because it's like you could believe as much as you want there's something wrong with your body, and somebody's consistently telling you like no, you're fine, like no, it's in your head. It messes with you quite a lot, and unfortunately I know from pretty much anyone that I know that has had endometriosis or has been diagnosed with endometriosis has pretty much always had the same experience. Like my auntie, for example, I'm sure she won't mind me saying, I think it took her a very long time to get a diagnosis, and it's affected her in different ways as well. And that was like probably going back around 30 years ago. So still now, I think even going back 50 years ago, there's not been any change in how quickly we are diagnosing women with endometriosis or treating it.
Yeah. So I mean, with that then, how do you deal with perhaps your social side of things and also working environments, friends, family, and then like I say, going into work environments, how do you kind of wrap them all together with your condition?
Work-wise, I actually had to leave my job because it was just constant. I was having to take maybe like 5 days to maybe sometimes 7 to 8 days, like working days off work. At the time I was working in recruitment, so I was working to targets every single day, and just not being able to even function properly because you get a lot of brain fog and stuff as well. That was really difficult because it was just like I can't keep up with this, and it was then adding on more stress, which again isn't good for like information and things like that. So I had to then make that decision for myself and just going, is this worth amplifying my pain and my symptoms for? Probably not. I know many people will not be in a position where they can just go, right, I'll just leave my job, that's fine. But I'm trying to work now on building up my own business so that I can focus on eventually helping women that are going through the same experience, but also wanting to kind of live their life as normally as possible, looking after their bodies, whether that's like mentally and physically. It's taken me down a whole different path that I like wouldn't have even thought of before. Friendships like now, I'm very fortunate to have some very good friends that are very supportive, very understanding, will just, crack on and let me do what I need to do and always check in on me. And whether that's just a case of like, we can't go out today or we can't venture out very far on a hike, but we can maybe go and have a walk around the towns and we know where the toilets are if I ever need it. They're very, very, very understanding, and I'm very lucky that my coach for nutrition and my gym, she's one of my childhood friends. She knows a lot about female hormones and nutrition and stuff anyway, so she's massively helped me with that side of things. So I now don't experience endometriosis bloat anymore, which is amazing because it's not nice walking around feeling like you're 8 months pregnant from eating like a slice of toast. So I don't have that anymore, but it's completely life-changing. Like I wouldn't be in the position I'm in now. I wouldn't be as mentally strong as I am now. And I wouldn't be going down the career path I am now. So.
Yeah. So going back to that and comparing the two, so comparing maybe a working environment to more of a social aspect with friends, do you feel when you were in that working environment that there was a full understanding from that working environment, or was it a case of they weren't fully aware of your condition?
It's hard. It is hard to kind of to put this out because when I was working in recruitment, I'd just come back from Australia, so this was still a very new job for me. My manager in particular, he was very understanding, and I was super lucky in that sense. I think for me, I don't like letting people down. I like to show up for myself, and I do try and live my life as normally as possible because I don't want a whole condition to take over my life. But he was very understanding. He was like, look, if you need to take time off, you need to take time off. It is what it is. But I don't think he ever really got around to researching it. I think the intent was always there, but everyone's busy, and it's quite hard to pinpoint. Like the job I had before that, thankfully again I had a manager that was very, very supportive. But if I again tried to kind of communicate what that was and how it affected me, it was almost a bit like, oh, okay, yeah, like just stand up and not deal with that. And actually, sometimes the best way is just to kind of go, okay, this maybe isn't a comfortable conversation. It maybe is a little bit private in some aspects, which I completely understand. But 1 in 10 women have endometriosis, and it's like if you want to keep people in the workplace, as we should be able to, there are ways around it, and the best thing actually sometimes is just to listen to somebody and kind of just ask that question of like, well, how does that affect you on a daily basis, and what can I do to support you? And that there might not be much you can do, but
do you feel your condition has played a huge part in perhaps the relationship with your own body in terms of how you now live your life? Would you see yourself living your life you are now if you didn't have your two conditions?
probably not, no.
No.
It's hard because I'm still now in a position where I don't know what my future is going to look like in terms of like my next part of my surgery. So my looking back from being like a dancer, I've always had some kind of maybe uncomfortable relationship with my body anyway. But then I think going into my laparoscopy, which is how you actually get a diagnosis for endometriosis, was my experience of getting diagnosis anyway. I was really worried that I was going to have lots of scars on my body, and that made me feel, incredibly uncomfortable. I'm super lucky that I only had 2. But I don't know what my future is going to look like with that, whether I'm going to have part of my bowel removed or all of it removed, and potentially living with a stoma. So I don't know what that is going to look like yet. That might not be the case, but from what I've been told, it doesn't sound great. So again, that's life-changing surgery, and obviously the body's going to look very different. So.
Yeah. Can you take it back to perhaps the part that gym and being a dancer has played in all of this going on? Because there's a lot of physical aspects to your condition, but mentally, has the gym and dance almost kept that grounding level from yourself? Or
definitely. Like it's really good doing physical activity to help your body like reduce inflammation anyway, so I know it's very good for me. But there are definitely times where I can't sit there and just go, right, I'm just going to go to the gym now, like bye. It'll be a case of these cramps going to kick in now, or do I need to maybe bring something with me in case something happens at the gym? Thankfully, nothing has. But there is always an element, whether it's going to the gym, going to yoga, going to Pilates, just leaving the house in general. There's always that anxiety of like, am I going to have an accident, or is something really embarrassing going to happen? Because I can't hide wearing a nappy under gym leggings. So you know, it's one of them.
It's one of those. So going back to perhaps a turning point for you, and you had surgery 4 weeks ago? How long ago?
About 6 weeks ago now.
6 weeks ago. And you're back in the gym?
Back in the gym.
Back in the gym already. So 6 weeks after post-surgery.
Yeah.
Talk to me about that one. Your recent surgery.
So
what did it entail? What was it?
Yeah. So my recent surgery, unfortunately, didn't go how I wanted it to go. So it's quite hard when you explain having surgery with endometriosis, because there's quite a few different routes around it. My recommendation for anyone that goes through it, but also how I did it as well, was to find an endometriosis specialist, and that's so important because there's kind of two different routes you can go down with a laparoscopy. It is investigative, but if you've got a endometriosis specialist doing that laparoscopy, if they find endometriosis tissue that is safe to remove, they can basically extract it, and that's basically like pulling it from the root and getting rid of it. So it's way less likely to come back. It still very much can, but it's way less likely. If you don't have an endometriosis specialist and you go down the laparoscopy route, the best they can do is burn the tissue. And when you burn the tissue, that has different kind of complications, and is a lot more likely to kind of come back as well. So I had an endometriosis specialist, and he was incredible. Like from the first moment I went to see him pre-surgery, he straight away was like, I don't know how you haven't had this surgery sooner. I went in and I was hoping, yeah, they'll find some endometriosis. There was always doubt that they would even find anything because of what I'd been told in the past. So I was hoping, best case scenario, they'd go in, find the endometriosis, and they'd be able to remove it. Unfortunately, in my case, they basically, a laparoscopy, if anyone doesn't know, is where they'll blow your stomach up full of gas, and they'll basically like use little tools with cameras on the end of it, and they can kind of see what is going on. In my case, when I woke up, they basically told me that my endometriosis was just too far gone. So it wasn't safe for them to remove anything. My rectum is glued and stuck together to the bottom of my left ovary. So it wasn't safe for him to operate on that. And that's now why I'm waiting to see a bowel surgeon so that he can hopefully unglue that, and then see what the damage is with the colon as well. So that in itself was really, really hard, because first of all, it's like I'm having the worry of, are they going to find anything? If they do, are they going to be able to do anything? So, and he also knew my situation and how I'd kind of had a lot of like medical misogyny and things. So when he woke me up, I was very, very emotional. It's a hard thing to get diagnosed, because one side it's like, thank God, like I know what's wrong with me. It's not just all in my head, but there's also the part of like, this is now, where do we go from here? So that was really hard. But getting back into the gym, again, my coach, she's just been incredible. So my usual routine was just cut right down to the bare minimum. During the recovery, you can't go to the gym for 4 weeks anyway, so that was testing, to say the least. I got myself out on as many walks as possible to be as physically fit as I could. But it shifted my focus completely. So I got a lot more into reading and understanding my condition a lot more. So from a mental aspect, it was very good. It gave me a lot of healing time. Frustrating, don't get me wrong, but gave me a lot of time to heal from that. And then getting back into the gym, it was just like rebuilding myself from scratch, and that's still.
Suppose that goes on to how have you managed that balance between having that surgery and having the thoughts of, right, do I rest or do I try and recover as quick as possible, by example going on these little walks? How does that physically again, but also emotionally and mentally, How does that how do you manage that on a day-to-day basis?
It is hard. Like, I'm
Yeah.
not going to sugarcoat it. It is. I had many days where, like, especially like in the first couple of weeks after my surgery, I just felt so frustrated because, actually, to be fair, the first 5 days after my surgery, although it was painful to kind of sit up and stuff, I was moving around pretty okay. Day 6, God, that slapped me in the face. Like,
You regret
I
it?
was like, oh my God, like I can't move anymore. Like, this is rough. I got the fatigue really kicked in, and for somebody that is already very active and likes to do things to look after her body, like, it was very challenging and very frustrating. And me and my coach had a lot of conversations where it was like, okay, but why don't we prioritise the stuff that you wouldn't typically prioritise because you'd focus on the gym and your nutrition and everything else. So nutrition was a huge part of it. But also it just, like, for me, I was just like, I want to understand my condition. I know that I want to further down on in life be able to help other women learn how to advocate for themselves, understand their hormones, understand like nutrition to help those hormones. So I just put all my effort and focus into that. Um, but yeah, navigating it was hard because it was like I wanted to get up and go for a walk, but I could feel ready to go. And about 10 minutes into that walk, I'd be like, yeah, like I'm just in too much pain now. So you do have to find the balance. You definitely do, because I don't believe sitting still and doing nothing was going to help me at all. But it was more a case of like, right, okay, I want to go for a walk, but what's going to be realistic? I'm not going to go and do my usual walk, so let's do a 5 minute lap around the block, and we'll maybe do that a couple of times a day. And also get some fresh air as well, because it makes a huge difference.
Yeah. Have you spoke to people in similar positions as yourself, and do you feel as though that is a helpful aspect, the side of things, where you can go into another community and speak to people who have been through exactly what you've been through already as well? Do you try and surround yourself with some sort of people, or is it a case of just going straight to medical?
I wouldn't say
advice?
I've like naturally fallen into that, but I do. Sorry, I don't. I've not kind of proactively seeked that. I've just naturally had a few friends that have gone. Actually, I struggle with that as well. And my friend recently, she got diagnosed with it as well. So we feel like we're a little bit closer now because of that. We'll be able to share a lot of things that you maybe wouldn't necessarily share with other people. But I have used TikTok quite a few times to talk about my condition. And obviously, when I found out about potentially needing bowel surgery, I had no idea what a stoma was until it was kind of brought to my attention. So the algorithm definitely helped us find each other. But yeah, I think it's incredible. I think it's amazing that so many people do talk about it. And I think when I have spoken about it, the amount of people that have been like, yeah, me too, like, you can come and speak to me about this. I've spoken about 5 different girls that have all had bowel surgery due to endometriosis, and they've just been so helpful with so many different things. And although I've got a lot of my own questions, and again, I'll be going to my own surgeon as well, it's just nice to feel that, yeah, it's not just me dealing with this, there's so many more people. And if we spoke up about it a bit more, maybe it would be a bit more normalised, maybe a bit more understood.
Yeah, I mean, you're very much into self-development, as you've spoken about already, but how do you feel as though, and you might have already answered this question, but how do you feel as though your condition has played a part in, for example, going for your walks, reading books, trying to learn about what's going on inside your body? How do you feel as though that's perhaps managed your direction in life? Do you feel as though if you weren't going through these conditions, that you would have been looking into different avenues to improve your health and to improve your general aspect of life?
I think there's always been an element where, like, I've always enjoyed the gym, I've always enjoyed being physically active and stuff, but nutrition definitely wasn't on the forefront of my mind for sure. I did used to be really bad with like ultra processed foods, really bad.
Go on, what kind?
Just takeaways. It was, yeah, I did go through a bit of a patch of that one, and I can sit here and blame my partner at the time as much as I want to. I still chose to put that food in my mouth. But now looking back at how I used to live compared to now is so different, and I do feel a lot better in a lot of aspects with that. Like I said, changing my diet up completely, I like hardly ever experience any bloating anymore. Being physical has always been a thing anyway, and I think a lot of that has been with the goal of an aesthetic in mind, Whereas now it's not just the aesthetic in mind, it's also, okay, well, if I eat this, I'm way less likely to feel bloated. I'm going to be able to perform better in the gym, which is then going to help my aesthetic side of things. But mindset, I mean, I've always had it in the back of my mind. I've always kind of researched like things like law of attraction, and manifestation and things, but I never really like committed to it, I'd say. Whereas now, because I'm having to kind of go on more walks, and because again that'll help with my digestion and everything else, and then tuning into more podcasts, and I found so many different avenues and learning so many things, and I'm definitely somebody that likes to keep my brain stimulated. I've always been that way anyway. So, but I think it's just amplified that more for me now to want to do more.
Yeah. What would you describe to people then, if people are going through similar to yourself, and perhaps looking at things in not the way you're looking at, as in life's not going to be the same, I'm not going to be able to do the things I want to do. You're still very much in the self-development and dance. You found your kind of purpose and connection, and to keep you going through that period of time. But what about people who maybe aren't into gym or physical exercise? Like, what would be your advice to them who are maybe going through similar conditions? And
I think the best
similar
thing
stories.
you can really do in those situations is actually get some like basic understanding of what your condition is and what is going to potentially benefit. Because knowledge is power. It really is. Like, if you don't know anything about your condition, you're not going to know how to help yourself. And there will be things like, especially with conditions like endometriosis, that will work for some people and it really won't work for others. There's quite a big thing around like anti-inflammatory diet and stuff. That I've tried, and there are definitely some things that I know I'll get benefits from, but with other people, they'll kind of say, well, that's just not work for me, so I'm not going to bother, I'm just going to deal with the pain. So I think you do have to be quite mentally strong, in terms of knowledge is one thing, but then it's what you do with that knowledge. And there's only so much you can do where you do it's one of those conditions where you do have to help yourself. It's not something like you want to change, you don't change anything and you expect it to change. It is a lifetime, long-term condition. But reaching out to people is a huge one as well, seeing what works for them, or even just speaking to someone and just being like, look, this is what I'm going through, this is how I'm feeling. Getting stuff off your chest is really important. So
what about people who don't have the condition and perhaps look from the outside looking in, and there's always a stigma attached to hidden conditions? What about for people who aren't fully understand of your condition? What kind of advice or even awareness would you give them to even put them on the right path or right direction to understand conditions like this?
I'm quite an open book. So if anyone asks me what my condition, I mean, I had it when I was waiting in there before, like, somebody asked me what I was waiting for. I was like, yeah, come on, podcast. They're like, oh, what's the podcast about? And I was like, oh, okay, it's about hidden conditions. And he was like, oh, but not you. Like, you don't have a condition, right? I was like, yeah, I do. And the kind of conversation switches very quickly. I've had it before when I've had to use disabled toilets, and somebody's, maybe looked at me and gone, why are you using that disabled toilet? You're obviously not disabled. I'm like, but I am, just in a different way. Like, respectfully, I'm not going, if I'm in pain, I'm not going to go and sit in a toilet with 5 other cubicles next to me. Like, no, thank you. But if anyone asks me, I am quite open, and I do kind of just say, look, this is how it affects me. Some people will be understanding of it, some people won't. And if anyone is kind of experiencing that, where they feel that maybe they have friends or sometimes family that maybe don't understand your condition, even though you've kind of expressed it, maybe they're not the people to gel with very often. I can relate to that. It's hard to say that, but
I can relate to that one. But in terms of awareness and understanding, what would kind of be your outlook on things to put out there? Is it for you fully understanding your conditions, as in from the outside looking in, or is it just for people to be aware of these certain conditions, or would you say both? Both. Yeah. How would you say that impacts a daily life of you from a perspective of nobody living with the condition you have from the outside looking in again?
As in, like, if somebody asked me what my condition was, isn't that type of thing?
So when you're going in the disabled toilets, and maybe someone has that pre-perception of, she looks well, she looks fine, and that actually gets voiced an opinion to you, how do you cope with that mentally as well?
I think for me, I'm quite.
You
I just say how it is. Like I just don't, like everyone's got different stuff going on, and like if you're looking at even at hidden conditions, like mentally, people are going through different stuff on a daily basis you wouldn't know about. So in general, like if people have the balls to say like, you're not disabled by using disabled toilet, I'll just challenge you on it.
Yeah.
I don't, and it doesn't need to be a rude interaction. It doesn't need to be any kind of confrontation or for that person to feel, guilty or feel that they shouldn't be using those toilets. Like you're using it for a reason and you have a right to use it. So if somebody is kind of challenging you on it, and I get everyone will be different, but for me, I'm quite happy to just kind of say, well, no, you just can't see that. And if I have to whip my nappy out to show that I'm wearing a nappy, then I'll do it. I'm really like I'm not bothered. Like, and if that puts people off, then fine, cool.
Best way to be. So what about then? So for you then, your biggest lesson from all of that. So all your story there. What's probably the biggest lesson on yourself that you thought, it is a few years back, I perhaps wouldn't have said that back to a person, or I wouldn't have had the confidence to be back in the gym, or I wouldn't have been confident enough to go back in the dance. What's your biggest kind of takeaway from all the years and experience in your path so far?
That I'm probably a lot more mentally resilient and I think everyone is more than actually what they think. And I think sometimes a lot of our worry is what's built up in our heads more than what the actual scenario will be. I mean, thankfully, I've never been in a situation where I have had an accident and people have been able to see that. That still causes me a lot of anxiety, as it naturally would do for anybody. But what I would say is actually people are also a lot kinder than we think they are. And yeah, that's probably what I'd say. I think a lot of the situations we kind of build up in our heads to be worse than what it is. But if also you don't communicate that's going on with yourself, how do you expect anyone to understand?
Yeah. So, bit of reflection for you.
Okay.
We're going to reflect on, if you were to go back all those years ago to when you were 14, 13, when you were first experiencing these signs, what would you say if she was sitting right there to that girl?
Ooh, yeah, that's a hard one.
So going through what you've gone through and everything you've been and everything you've said so far, if 13, 14 years old you was sitting there right now, what kind of, and take I know it's going to be a difficult one to remember, but take yourself back to those moments when you were thinking, what's going on in our body? Like, things aren't right. What would you now say?
I think for me it's more kind of saying to like just to trust herself a lot more. Like something clearly wasn't right. And I think you can get caught up in what I would call white coat syndrome, where you kind of, the doctor's telling you something so you just believe it, but actually you know your body very well. And I think what I've definitely learned now over the years that I do know my body very well, and if something isn't right, 9 times out of 10 it isn't. That's happened through injuries and stuff like that as well, where I've been right and I've been told otherwise. So, but also like, it's hard because I wish that she didn't have a voice then. She didn't know how to advocate for herself. A 13, 14, 15-year-old girl is not going to know how to say to, and is not going to have the confidence a lot of the time to say to a doctor, no, you're wrong, this needs to be looked at more. But I wish there had been more support there, or more, I don't know, like knowledge around how to advocate for yourself a lot more. I think that is starting to come out from a lot of people that I've seen on social media and stuff now. There is more awareness of it, but I wish that she'd known how to advocate for herself more, because she might not be in the position that she's in now, but also not to blame herself.
Yeah, no, you've got to look at how you were in that moment, and you thought you did what you did at that time was right. But going on to perhaps somebody who's in a position what you were all them years ago, what advice would you give them if they were waiting for a diagnosis, or if they're waiting for perhaps advice and maybe they're getting in their heads and they're worried about what's to come? Is it a case of just staying present every day? Is it a case of reaching out to people like yourself? What does that look like?
I would say reaching out to people that you think are in the same position. Like, if you've not got a diagnosis, yes, it is hard, but typically, like, and this is just speaking on endometriosis, no other type of condition, but I think when you've got a condition like that, it's so important to kind of to research it and also kind of speak to other people that have it as well. Also, I'd again bring it back to advocating for yourself. Like, it is so important, and I wish more people knew how to do that at a younger age, because, like I said, and from my experience, getting put on the pill, all that does is mask your symptoms. So the endometriosis can still grow, it can still fester. So it's like how I would explain it to people, which I think is a really good analogy, is like if you went in to hospital and you'd cut your head wide open and you could basically see into your brain because it's that bad. And instead of like having your usual treatment where somebody would stitch your brain, it's like stitch the skin back up together and let it heal and bandage it up, instead they just stick a fat plaster on it and go, like, there you go, see you later, like, you're all sorted, you're healed. No, like, that's so far from the truth. And I think there should be more knowledge on the pill, there should be more knowledge on the contraception, so that young women can make more informed decisions and also know how to advocate for yourself and be able to say, okay, well, if you don't think it's endometriosis or PCOS or Hashimoto's or whatever that is, what else do you think it could be? Rather than just accepting, well, that's not what it is, so clearly this is just normal and crack on with life, because it's not.
Yeah. So we're going to go for some light questions for you now. We're going to create this a little bit short. Yeah, some light questions for you. So throughout this full time, and I think you've just said there, what's one small thing that's perhaps always brought you peace or joy throughout the full time, even on those hard days? What's that thing what's almost like kept you going? Because you're still here, you're back in the gym, you're dancing.
Yeah.
Within 4 weeks or 6 weeks of having surgery, like, huge, incredible achievements. What's that one thing that's got you to the point you are now?
I think it's the idea of what I want my future to look like.
Yeah.
I know that although I do have bad days, which I definitely do, and I'm not going to sit here and say I don't have days where things get really dark, because they do. But I also do know that I will have days where I feel better and I feel lighter and I feel more like myself. So I amplify everything that I can do on those days, and remind myself of what I want for my future, and know that there is some light at the end of the tunnel. It might look completely different to how I thought it was going to do, but I still have a lot of things that I'm really, really grateful for. It's brought me and my family so much closer together, my relationships with them, same with friends. Like, I don't feel like the substance is lost with those friendships anymore. It's a lot deeper. So I think I'm very, very lucky in that sense, and I'm very grateful for what I have now, and also what I want to open the future up to be like that. And that's what keeps me going. It's the excitement for
So to fill that out, what's really needed for you, isn't it? And yeah, what about, so next light question for you. If you could have a coffee or a chat with anyone, alive or gone, who would it be and why?
Oh.
So we'll go three people. Three people. So think of obviously your journey you've had, your path you've had, your self-development side of things. Who would you like to have sat around this table?
So I've only come across her pretty recently. I think she's been around a little while. So there's two girls actually, both run their own podcasts. So one is Grace Beverley.
Okay.
And the other one is a woman called Sophie Richards. So they talk a lot on their podcast about PCOS, but also her Working Hard podcast. This is Grace Beverley. She talks about so many different things, in terms of like self-development, career, whether we have to have a title on things. She talks about relationships, she talks about all kinds of things. She's incredible, some of the stuff that she talks about. And Sophie Richards is also incredibly knowledgeable about endometriosis. So I'd love to be able to sit down and have a...
Have you just come across them fairly recently, did you say, as well?
Fairly recently, yeah. I'm a big podcast girl, so probably a lot of these are going to come from then. Probably Mel Robbins as well.
Mel Robbins, yeah, good choice.
Big Mel Robbins fan. I love her Let Them Theory. That's taken me far.
Yeah. Do you feel that's come in very handy from your condition, what you've been through, to now, to the point where you are now, to not deal with outside noise, if you like, and not deal with outside opinions?
Yeah. It's that, and also you've got to learn to have boundaries with people as well, especially with conditions like mine. Like, I can't go out and do anything and everything. Like, it isn't going to work. And sometimes I have to be kinder with myself in terms of saying, like, as much as I want to do that, like, that is going to put me out for like 5 days afterwards, so it's not worth it. But I've been in these situations in the past where people have made those decisions for me, said, well, we won't invite her because she won't be able to do it anyway, so what's the point? And it's like, just let them do it, it's fine.
Yeah, so speaking of social media, is Instagram, you're very active, I know, on social media. Is Instagram your best form of putting things out there and content?
I'd actually probably say TikTok.
Okay.
I don't know why, I feel like I could probably be a bit more vulnerable on TikTok.
Yeah.
Because the audience just comes from anywhere and everywhere.
Yeah.
Whereas Instagram, it's a lot more your followers that see it. So, and like, it's something I still need to get over, because there are probably some things I wouldn't put on my Instagram just purely because I've got people on there that know me very well. So it's still kind of breaking that barrier a little bit, which I'm getting so much better at. But TikTok is, I don't know, I don't know if you've maybe experienced the same, like, I just find that TikTok is a lot more receptive.
No, I agree. I think with Instagram, it's very much filtered, people coming through, filtered audience. What I will say is that with your Instagram and with your TikTok, are you happy for me to put that out in the comments?
That's fine.
So if anybody wants to reach out and obviously relate to your story, then they definitely can.
My little weird pages.
They can drop you a follow and drop you a message. But Kate, what I'm going to say is, to finish this, like, I know from myself and people watching and the viewers, the perspective, I think you've changed that perspective on conditions like yourself, and to be in a position you are now and to be openly sharing your story as open as you have goes huge miles to you, and you should be very, very proud of yourself, and you've definitely come a long way, and I can't wait to see what you've got planned in the future as well.
Thanks, me too.
But other than that, I will drop your Instagram and TikTok in the comments, and anybody can watch. But Kate, it's been a pleasure, and thank you very much.
Thank you.
A huge thank you again to Kate for sharing her journey with such honesty and strength. Living with endometriosis is something many people never see or understand, and her voice is going to help so many feel less alone. If you'd like to follow Kate's journey, you can find her on Instagram at Kates_fitness. The link is also in the description below. If this conversation gives you comfort, education or inspiration, please share it with someone who might need to hear it today. And don't forget to subscribe on YouTube and follow on Spotify. Every like, comment and share helps these real stories reach the real people who need them the most. Thank you for being a part of Nothing to Hide, Hidden Health Stories.